Presidential spokesman Roque downplays news that the Philippines replaces Indonesia as a Southeast Asian country with the most COVID-19 cases. At a press briefing Friday, August 7, Roque says the Philippines recorded the highest tally of infections in the region because of increased testing.
Ibig sabihin po, dahil mas mainting ang ating pagtetest, hindi po totoo na mas maraming kaso tayo kaysa sa Indonesia. Hindi lang nalalaman ng mga Indonesian kung sino-sino yung mga umiikot na meron na pong sakit.
On Thursday, August 6, the Department of Health said the total coronavirus cases in the Philippines climbed to 190,460. The Philippine tally was more than the 118,753 total infections announced by Indonesia's health ministry on that day. But when pressed to substantiate his claim, Roque backpedals.
Hindi ko po alam how to answer that. Basta ang malinaw lang po sa akin, ang Indonesia po, with almost more or less the same cases as us, has 1/3 of the actual testing that we have conducted on our people. No? So, yun po ang aking basis for saying na hindi naman talaga totoo at conclusive na mas marami na tayong kaso sa dito sa Pilipinas compared to Indonesia. Mas marami lang tayong kaso na nalalaman na dito sa Pilipinas dahil nga po 3 times ang ating testing more compared to the testing done by Indonesia.
While wider testing could account for increased numbers of confirmed infections, Duterte's pandemic task force earlier admitted the infections were driven by the reopening of some parts of the country and the return of overseas and stranded Filipinos to their provinces. As of Friday, COVID-19 cases in the Philippines reached the 120,000 mark as the DOH reports 3,379 new cases, bringing the total to 122,754. Meanwhile, a new study from South Korea shows people infected with the coronavirus carry similar levels of the pathogen in their nose, throat, and lungs, whether they have symptoms or not. The study provides strong evidence supporting the idea that asymptomatic carriers can spread COVID-19. The median time taken for the patients to return negative tests was 17 days for asymptomatic patients and 19.5 days for those symptomatic.